We are live on YouTube.
All right, perfect. Khadija, start the recordings as well. Khadija will do the recording, Sarah.
Okay.
Smarak, start sharing the live stream.
Assalamu alaikum, everybody. How are you?
Is it? Sarah, walaikum assalam.
Yes, it's me. I woke up from a nap. My voice is good.
Wow, why nice, nice. You're in your dreams or mungadaltam.
No, I joined on time. So, like, I was on my voice to come back.
Just kidding. Yeah, it's okay to do.
How is everything? Is everything streamlined?
Yes.
Recording,
So, sab
screen
kuch-
sharing, mic, speaker, everything.
yeah, everything is cool. बस अब दुआ करते हैं कि सबसे सही हो जाए.
We're gonna have a
So
lot.
one thing, like if you guys have started the recording and if you guys have started the live streaming, then you guys should, maintain a professional code of conduct.
Yes.
Yeah.
Thank you.
And आप अपना सब कुछ set करें. Open your camera and stuff. बस the recordings as a recording starter. All right, Dr. Jahan has joined us. Assalamu alaikum, sir. Khadija, please इनका mic unmute करें. Assalamu alaikum, sir.
वालेकुम सलाम। वालेकुम सलाम। आप कैसे हैं? सब ठीक ठाक?
बिल्कुल ठीक सर, आप कैसे हैं?
शुक्र है। स्टार्ट तो नहीं हुआ?
नो सर, बस अभी डॉक्टर इकबाल को मैंने सेंड किया लिंक, वो ज्वाइन करे तो फिर स्टार्ट करते हैं इंशाल्लाह.
ठीक ठीक ठीक। Muhammad is a presenter.
Yes sir. Assalamu alaikum sir.
Walaikum assalam.
Welcome sir.
Thank you so much, beta.
वालेकुम।
Walaikum assalam.
Assalamu alaikum, sir.
Walaikum assalam, everyone.
Ahmad. So Ahmad कौन हो जाए फिर हम स्टार्ट करते हैं. वजाहत.
I'm here, you guys can start. Assalamu alaikum, sir. Assalamu alaikum, Dr. Jahan.
Walaikum assalam.
वालेकुम सलाम।
So it's nice to initiate another academic event. So heads up to SRC chairperson, Dr. Jahan. Thank you so much.
Thank you so much. It's all because of our talented students of SRC. They have always made us proud. The faculty is always proud of our students, and inshallah, it's the first time that the research module pre-conference webinars will be wholly and solely conducted by our dear SRC students and few are, I think, fresh graduates as well. So we are honored. We are with them. We are backing them in every step.
Yes sir, thank you so much for your constant support. Should we
Thank you so much, sir. Sir, one more thing. For the first time, we're live streaming this on YouTube. So
YouTube.
anyone from anywhere in the world can join. The attendance is free. So hats off to this idea as well. It's being live streamed. और वो जो limit है 100 लोगों की Zoom में, तो वो limit नहीं आ रही. We can this can reach as many people as possible.
Exactly. Wajahat, please start कर ले आप session. Over to you.
Am I audible?
Yes, you're audible.
Greetings, ladies and gentlemen. On behalf of Student Research Committee, Khyber Medical College, Peshawar, it is my immense pleasure to welcome you all to the very first session of our national webinar series, Foundation of Research, a Beginner's Pathway. This comprehensive 6-part online webinar course developed under the guidance of Research Cell, KMC, aims to empower beginners researchers from all medical colleges across Pakistan. It will take you step by step through the process of conducting, analyzing, and publishing medical research. All sessions of this program will be conducted by SRC affiliated mentors, students, and speakers. Ladies and gentlemen, before we begin, I would like to extend a warm welcome and express my sincere gratitude to our distinguished guests for joining us today. Dr. Iqbal Haider, Associate Dean, Research Cell, Khyber Medical College. Dr. Jehan, Chairperson, SRC, Khyber Medical College. Thank you for gracing this session with your presence. Ladies and gentlemen, I, Wajahat Hanif, Assistant Director Activities, SRC, Khyber Medical College, am honored to be the moderator of the very first session of our research course, Introduction to the Basic Concepts of Research, its types, and why medical students should get involved. The learning objectives of today's session, as the title indicates, includes to introduce the basic concepts and foundations of medical research, highlight the different types of research and their significance, emphasize the importance of research involvement for medical students. Dear audience, our speaker today is none other than Muhammad Ahmad, a final year medical student at KMC and former president of SRC KMC. Muhammad Ahmad is highly experienced in the field of medical research, especially in data analysis, manuscript writing, and meta-analysis, with over 20 publications to his name. Today, he will guide us through the essentials of medical research and how we as students can begin our journey in it. Before we proceed, a few important reminders for all the people.
Wajahat, wait a second. Dr. Sulaiman Ilahi has joined us. Welcome, sir. Assalamu alaikum. Somebody unmute him.
Walaikum salam. Sorry, I was with the patient. अभी उसको मैंने फारिग किया तो I saw your
No
message.
problem, sir. Sir, thank you so much for joining us.
You're welcome. अच्छा
Ladies
आज
and gentlemen,
जी आप बोले
we are graced by Dr. Sulaiman Ilahi Malik, the Assistant Associate Dean of Research Cell, Khyber Medical College. Thank you, sir, for gracing our webinar session.
You're welcome जी बहुत अच्छा इनिशिएटिव है आप लोगों का रिगार्डिंग दिस जो एक ही बात है समझने की कि हमारे जो स्टूडेंट्स होते हैं वो आते हैं उनका फर्स्ट ही इम्प्रेशन ये होता है कि हम इम्पैक्ट फैक्टर में चले जाएं. यू कैन गो टू इम्पैक्ट फैक्टर, लेकिन पहले आप लोगों को ये समझना चाहिए कि सर्च करते किस तरह हैं. तो यू कैन जो जितने भी जो जर्नीज होते हैं दे स्टार्ट विद अ सिंगल स्टेप. सो डू योर रिसर्च पेपर एट योर ओन. बेशक आप उसको किसी नॉर्मल जर्नल में जमा करें. जब एक दफ़ा आप सारे प्रोसेस से गुजर जाते हैं तो यू बिकम एक्सपर्ट ऑफ इट. फिर आप अपने लिए जर्नल जो है सजेस्ट कर सकते हैं कि आप लोग इम्पैक्ट फैक्टर में चले जाएं. लेकिन ऑलवेज डू इट आफ्टर सम लर्निंग एंड हैविंग सम एक्सपीरियंस. डायरेक्ट जंप लगा लेते हैं फिर उसमें जो है ये चीज़ें आप एक दफ़ा किसी जगह पे गलत पब्लिकेशन हो जाए आपकी तो वो फिर सारी उम्र आपके साथ नाम रहता है, या खुदा न खासा रिट्रैक्शन हो जाए आपके आर्टिकल की तो वो भी आपके साथ रहता है. तो फिर आजकल तो इंटरनेट की दुनिया है, ये चीज़ें फिर आपके साथ रहती हैं, फिर आपको जो अननेसेसरी जस्टिफिकेशन और क्लैरिफिकेशंस देनी पड़ती हैं. इसलिए डू स्टार्ट विद स्मॉल स्टेप्स और ओरिजिनल काम करें, लालच ना करें शुरू में चीज़ों की खातिर, और अच्छा काम करें ताकि वो जब पब्लिश हो तो आप लोग उसको सारी उम्र अपने साथ लेके चल सकें. तो बहुत अच्छा इनिशिएटिव है एसआरसी का, डॉक्टर इकबाल हैदर का और डॉक्टर जिहान का कि उन्होंने ये प्रोसेस शुरू किया. और सिंपल प्रोसेस यही है कि आप लोग स्टार्ट से शुरू करें, सिंपल बातों को पहले समझें और फिर उसके बाद कॉम्प्लिकेट चीज़ों की तरफ जाएं तो आप लोग सब सीख लेंगे. तो ये बड़ा अच्छा इनिशिएटिव है. हमारा प्लान भी ये था, डॉक्टर इकबाल हैदर का प्लान था कि हम लोग पीएमओस के लिए भी कैसे एक छोटा सा शॉर्ट मॉड्यूल बनाए जिसमें हम उनको सिंपल बातें बताएं, जैसे कि टॉपिक कैसे सेलेक्ट करना है, सैंपल साइज कैसे कलेक्ट करना है, इंट्रोडक्शन में क्या क्या लिख सकते हैं हम, मेथोडोलॉजी कैसे सेट करनी है. छोटी छोटी बातें, इट दे हार्डली टेक अ मिनट और टू आप जैसे इंटेलेक्चुअल लोगों को समझाने के लिए. लेकिन एक दफ़ा आप समझ जाएं तो फिर आप लोगों से गलतियां नहीं होती और आप लोगों का रास्ता काफ़ी सीधा हो जाता है। तो इंशाल्लाह ये इनिशिएटिव अच्छा है। सुंदर से बीइंग प्रेसिडेंट, सारा बीइंग वाइस प्रेसिडेंट, और जो बाकी टीम है और आपके जो मेंटर्स हैं, अहमद को तो हम जानते हैं फिर लास्ट ईयर से, तो अच्छी बात है कि आप लोगों ने इनिशिएटिव लिया और अपने जूनियर्स को, जो जो बंदे इस फील्ड में नए हैं, उनको सिखाने के लिए, और आप लोग ये सब ख्वारी करते हैं। तो ये सदका जारिया भी है और आप लोगों के लिए भी अच्छा है कि आप लोग एक और एक्सपर्ट हो जाते हैं। तो बेस्ट ऑफ लक फॉर दिस। और मेरी जहाँ पे भी हेल्प की जरूरत पड़े, आई एम ऑलवेज अवेलेबल। डॉक्टर इकबाल भी हैं, डॉक्टर जिहान भी हैं, तो हम हमेशा आपके साथ रहेंगे जहाँ पे भी आप लोगों को हमारी जरूरत पड़े। ठीक है, थैंक यू।
Thank you, sir. Ladies and gentlemen, before we proceed, a few important reminders for everyone. Please keep your microphones muted to ensure a smooth experience for all the participants. This session is being recorded, and by attending, you consent to be the part of this recording. If you have questions during the session, kindly type them in the Zoom or YouTube live chat box. All of your questions will be addressed during the Q&A session at the end. All of you are requested to use your real and full names during the entire webinar. It will help in marking your attendance and distribution of your certificates. Please maintain a professional and respectful tone in all forms of interaction. Now I would like to invite Muhammad Ahmad to take over this session. Muhammad Ahmad, the screen is all yours.
Thank you, Wajahat. I commend the efforts of the entire SRC team in organizing this research series. I'm very thankful that they invited me to participate in this. So the topic of my presentation would be an introduction to research. So we're just going to go over the basics of research. I'll just go to the learning objectives. So first we'll discuss why is research important, and then we'll explore different research methods. So most of you guys probably also already know why research is important and what is research. So when you guys, put the term research on Google or in a textbook, you guys will probably see something like this. Research is the systematic collection, analysis, and interpretation of data to answer questions or solve a problem. So simply put, what this means is, research means finding, asking a question and finding an answer to it, and doing this in a systematic way. Now we do research, indirectly, unknowingly, we do research all the time. For example, you guys think that you guys may have heard of different brands of ketchup. For example, I think Heinz is considered as the, as the best, the most widely used ketchup brand worldwide. And then there are many different local brands of ketchup in Pakistan. Like I think there's National and, Knorr, Canas, etc. So someone asks, like, let's say you like Heinz, and then your friend likes National or, Canas ketchup. So you say no, like Heinz is the best, and the other person says no, Canas is the best ketchup brand. So what you guys do is, you guys take a neutral approach. You both of you, put two ketchup, both the ketchups in a plate, and ask someone, a neutral person, third person, to taste each one, and they can then say which one is better. So this is basically you guys are doing research. Then the thing is, I like cooking, so I was initially when I used to cook steaks, I used to run into the problem of the meat would be very dense, it would be hard to chew, and it would not taste very well. So I asked my parents, I asked my mother, how can I make the meat tender? And she told me, you can cook it in a pressure cooker. You can cook it on a slow heat, or use some sort of tenderizer. For example, people use wild papaya powder to tenderize the meat. So these are different ways to to make the meat soft. A person can do all of these methods. Compare steak that is cooked without tenderizing with versus one that has been tenderized for let's say 1 hour, and compare it, which one tastes better, which one is more tender, and that is basically you guys are doing research. But the problem is that this research is not systematic. Systematic refers to a predefined criteria. Before we do research, a medical research that can be published in journals, that can be approved by institutional review boards, it has to have a proposal or a synopsis, and this is something that that will be discussed in the upcoming webinars as well. But really quickly, if I summarize it, you have to have a pre-specified criteria, something that can be replicated. For example, you do a research, I should be able to do that exact research if I want to do it. And this can only be done if you do do something systematically. If you say, I use this amount of meat from this breed of cow from for this temperature, I use this brand of butter or this brand of cooking oil, and I use this brand of, tenderizer powder, etc. So this is something that when you mention all of these things, you make the research systematic, and this is something that can then be approved by institutional review boards, and this is something that can then be published. So this was a really simple definition of research. Now, why is research important? So the thing is, this question has different answers depending on who you are asking it from. So if we're looking at a government level or the entire or a global level, understanding climate patterns, understanding weather forecasts is important because you can predict whether there would be a storm, whether there would be a cyclone or an earthquake somewhere. Recently, I think there was an 8.8 magnitude earthquake off the coast of Japan or something. So if you guys can predict using by studying climate patterns, weather patterns, if this is something that, or the earth, the way the earth crust moves, if this is something that can be predicted, then precautionary measures can be taken, and these disasters can be avoided. You can plan for the future by looking at population patterns. Now, from the medical point of view, if we talk about the clinician, to a clinician, research is important because it helps the clinician make patient decision, informed patient decisions. So let's say there's a consultant and and he's dealing with a patient who has hypertension. And there are thousands of different drugs for to manage hypertension. How does the clinician know which drug the patient should get? For example, let's say there's drug A and drug B. Both of them are used for hypertension. Which drug should the patient get? And this is something that the clinician knows by following guidelines. And how have these guidelines been developed? These guidelines have been developed through research, through meta-analysis, through clinical trials. So that is the importance for a clinician. For a researcher, someone who wants to, pursue the field of research, it can be a job, it can be, they can work in this field, make discoveries, they can, find new drugs for different diseases. They can understand the pathophysiology of diseases, look at different receptors, and for undergrads, for us, research is important because it is part of our medical degree. The PMDC has a criteria, I think it is called as the 7-star or 5-star doctor, and one of that star is for being a researcher. Doctor has to be someone who understands research and is able to do research. So research is an integral part of, our degree or MBBS degree, or I think it would be the same for dentists and other healthcare professionals as well. Other than that, research is important because it looks good on a CV. It tells your employer that that this person goes beyond just studying. He's someone who is willing to put in the effort to to work for his patients in order to ensure that they get the best possible treatment. And it doesn't matter if you want to pursue research, if you want to pursue training in Pakistan or abroad. Research is something that will help you regardless of where you're going. So that is, real quickly the importance of research. So we have the research definition and importance out of the way. Now let's look at the types of study design, our second learning objective. So there are many different types of study designs. I think If I can, if we had a webinar on each one, we can probably we can spend hours on each study design, because there are many different sub-classifications of each study design. Here, I'll be briefly discussing the most important research designs that I think are relevant for, for undergraduate researchers, and that are relevant. Most of up to 90 to 95% of the research that is being done at an undergraduate level currently is involves these type of study design. So this slide, as you guys can tell, it says hierarchy of evidence pyramid. Now, these are different types of study design. At the bottom, we have case report and case series. Then we have cross-sectional studies. Then we have case control studies. Then we have cohort studies. Then we have clinical trials. And then we have meta-analysis. So these are the most common study design. And as you go up the pyramid, the strength of evidence increases. So what do we mean by strength of evidence? So, at the start, I told you guys that, research is about finding, about asking a question and finding an answer to that question. Now, let's say two people have the same question. Two people have a question that I want to test which drug is better for hypertension, and they're comparing two drugs, drug A and drug B, and they're testing it on patients who have hypertension. So student one does a cohort study, and he finds out that drug A is better for patients with hypertension than drug B. And then student two is doing a clinical trial, and student two finds out that drug B is better than drug A. So the thing is, both of them did everything systematically. Both of them did research. The research didn't have any huge problems. So which result should we go with? We'll go with the clinical trial, because the evidence, the strength of evidence is greater. It is higher up in the pyramid as compared to the cohort study. So we'll go with student one, student two, who said drug B is better because he conducted a clinical trial, and clinical trial can produce better quality of evidence as compared to cohort studies. So now we'll discuss the main types of study designs. So the first type of publication that I'm going to discuss is letter to the editor. So first of all, letter to the editor is not a study design. It is no, we can't even, I don't think we can even call it research per se, because it does not follow a systematic approach, but it is a type of publication. It is something that is a very easy to publish type of article. So that's why I included it, just so you guys know what letter to the editor is. So the slide says a short letter to the editor is a short communication published in academic journals, typically in response to a recently published article or to raise awareness about an important issue. And it is an accessible entry point into academic publishing, often with minimal formatting or peer review requirements. So what is peer review? Whenever you guys do a research, write a research paper, and when you submit it to a journal, if the editor likes the paper, he will send it for peer review. So he'll send it to various experts in the field, and they will then go through the entire paper and critically analyze that paper. And they can see, if you followed a proper criteria, are your results, acceptable, or are there any problems with your research? And then the peer review, then those reviewers can say, they can ask the editor to, either accept the paper, or ask the author to make changes to that paper, or they can just simply say, that this paper is not relevant, or it has these problems and it is not fit for publication. So this peer review is quite a headache when it comes to research, and you guys will, those of you who will be doing studies, I hope most of you guys do that. Then you guys will know, okay, peer review can be quite a headache. So this is something that is avoided in letter to the editor, because per se it's not research. It is something that, you guys probably in secondary school, we used to write letter to the editor to a newspaper, and it used to be, there's a I think we used to write a letter to the editor for, that there was a lot of air pollution let's say there's a lot of air pollution in your city. So you want to raise awareness regarding this issue. So you write a letter to your local newspaper and tell them, that there's air pollution in my area, and air pollution is associated with, with cognitive decline, is associated with respiratory problems, and it can reduce lifespan. And then that they should ask the government that they should make these changes in order to address this issue. So that is basically what letter to the editor is. But instead of a newspaper, you are writing it to a journal. And then there are common types of letter to the editor. You highlight a recent discovery, uh, raising a clinical or public concern, and critiquing or commenting on a published study. So highlight a recent discovery. Most of you guys probably know I think Dr. Suleiman is here with us. He knows a lot about the GLP-1 medications, that have been recently approved for weight loss. It has been, I think, a few years, but last year, some juniors asked me, and they told me that one of the combined GLP-1 and there's another receptor, I forgot the name for it, agonist. There's a dual agonist called esterzapetide. It has been approved for obstructive sleep apnea. So that was, a quite significant discovery. And they told me that, can we write a letter to the editor on it? And I told them, yes, absolutely. And they wrote a letter on it, and they basically highlighted that there's this discovery, and this is something that the clinician should know, and they should include this in the treatment regimen for patients who are suffering from obstructive sleep apnea. And it got published in a very good journal. So the second type is raising a clinical or public concern. For example, the best example of this could be, every year in the summer especially, we have cases of brain-eating amoeba, the Naegleria fowleri, in Pakistan, because people are, swimming in pools, and sometimes the pools are not well chlorinated. So there's this amoeba called as Naegleria fowleri. It can go through the nose, and it can enter the brain and cause encephalitis, and it has a very high mortality rate. And it is something that I think there are a cluster of cases every year. So this is something that you guys can, write a letter on, that there's this issue, and then people should and then you guys should give some steps how to address this issue. This can be addressed by simply by chlorinating water and by raising awareness. Another type would be, there was a recent outbreak of monkeypox. So you guys can, a letter could be written on that as well. And I think these are letters that have already been written. Another issue is, I think, vitamin D deficiency. It is an epidemic in Pakistan. So I'm sure there can be a letter to the editor written on that as well, that you want to highlight this issue, that there's vitamin D deficiency, and that clinicians should, include this test, because I don't think vitamin D test is being done routinely for patients. So we can say that this is something that clinicians should think of when they have a patient who is reporting, who is, is saying that the complaining of bone pains, and is someone who is not going out that much. You can definitely write a paper on that, a letter to the editor on that as well. And the third type is critiquing or commenting on a published study. So this is something where you come across a research paper. If you read it, and you find out that there are some problems with that research, as Dr. Suleiman Elahi mentioned, that there's a thing called as retraction. Just because you publish a paper doesn't mean that, it will be there for the rest of time. There's a possibility that, that someone, 10 years from now goes back and looks at that research that you did. And if they find out that there are some problems with that research, or if there is some some mistakes in that, then they can write a letter on it. Then they can send it to the letter to the editor, and ask them to convey the message to the author that there are severe limitations in this study, and they should address that. And if the author is not able to address those limitations, or those concerns, then there's a possibility that that paper can get retracted. And I've seen a few papers get retracted as well. So there are retractions happening every day, hundreds of retractions. So this is something that should be, that we should keep in mind while doing research. And because just because there's some mistake doesn't necessarily mean that that paper would be retracted. The author can agree, okay, that there are these limitations, or if the author doesn't agree, then they can say that these are that these aren't limitations. There was a reason for it, or that these limitations have been addressed adequately. So now I'll give you guys some examples of letter to the editor. So I had some examples. I don't think it is in this slide. It is in this presentation. I'll share it at the end. We'll just move on to the next type of research design. So this is a proper, now we're moving to proper research designs. And the second type of research design is case report or case series. So if you guys remember, this was at the bottom of the research pyramid. Case report is a detailed description of a patient's medical history, diagnosis, treatment, and outcome. So, we in third year we go to ward, and the first thing that we do is we take patient's history. After that, we do general physical examination, and special examinations of abdomen, the nervous system, etc. In at house officer level and at training level, then people start prescribing tests, diagnosing the patient, and treating the patient. So basically, case report is what we are doing every day, what a clinician is doing every day. So for a clinician or even for a medical student, this should be the simplest type of research. The easiest form of research is a case report. But the thing is, we have hundreds of thousands of patients, coming every month. You can't write a case report, or you can't publish everything. Case report is basically something that a clinician feels, or that a medical student feels, is that there was a case, that there was a patient, and that patient had some unique findings, some unique characteristics, and that clinician wants to share it with his fellow clinicians or the entire medical field. So that clinician writes a case report on that patient and publishes it, and other clinicians can then read that case, and they can then comment on that, or they can then incorporate that knowledge in their own clinics. So that is what a case report is. And case series is the same thing, but it involves a group of patients who have a similar disease or a condition. Case report focuses on a single patient, and a case series involves a group of patients with a specific disease. So some examples. So we had this case, there was a patient who presented with, chest pain and ST elevations. So that patient had classic symptoms of myocardial infarction. But when the further testing was done, troponin, etc., all of the stuff was done, and the angiography was performed. Normally, if a patient has myocardial infarction, then that patient has a thrombus in the coronary artery. That there's a plaque in the coronary artery. But this patient, the coronary arteries were fine. They were, as the title says, the patient had non-obstructive coronary artery. This is a term. There's a term called as MINOCA, myocardial infarction with non-obstructive coronary artery. So that is basically what the case was. And then, after further testing, it was found out that the patient actually had ST elevation, MI secondary to pheochromocytoma and thyroid storm. So what is pheochromocytoma? Pheochromocytoma is basically a tumor of the chromaffin cells in the adrenal medulla, which secrete epinephrine and norepinephrine. Basically, it causes palpitations, elevated blood pressure, and this is stuff that happens episodically. And thyroid storm is something that is observed in patients who have hyperthyroidism and they undergo decompensation. So basically, it's not relevant that you guys understand what pheochromocytoma and thyroid storm is. Basically, this was a rare case. we found out that there was a patient with, with chest pain. Normally, patient with chest pain has, there's a list of condition. Patient may have GERD, patient may have, myocardial infarction. The patient may have, costochondritis or something like that. But this patient had a very unique presentation, and this is something that you guys can then we basically followed the entire course of the patient, and we described it, and it got published, and it got published in a good journal. Another example would be this. This is one of my friends published this paper. The title says a rare case of P63 negative sinonasal net midline carcinoma in the elderly. So this was a very rare case. I think this was the first such case recorded in Pakistan. And this is stuff. These are patients that we see in KTH. These cases are from KTH. So these aren't cases that came from some other country. These are cases that are or consultants will know that these that there are that they with every clinic or every few clinics, I think every week they probably see a patient who has a very unique presentation. And I think at least every month there would be a patient who has a condition that would be unique enough that a case report can be written. But clinicians usually don't have time to write a case. So if you talk to your consultants, if you tell them, I'm interested in this, if you have a rare case, or if you simply, go to the wards and go through the entire, the patient files, you probably will find something that is unique. And usually in our wards, whenever there was a patient with a unique presentation, or consultants would take us to that patient first thing when we came into the ward, because they want to highlight something that is unique as well. So you'll probably find these patients very easily if you guys pay attention, and this is something that can be a gateway into your journey in the field of research and in the field of research publications. So now we'll talk about, the classic types of study, cross-sectional study. So the quintessential, I would say, type of research, the most common type of research that medical students do, undergrad students do, is cross-sectional study. The best way to understand a cross-sectional study is through an example. Let's say you want to understand, you want to detect, you want to calculate the incidence of hypertension in Peshawar. So you can't go to every person in Peshawar and ask them, do you have hypertension or not? You will you will say, there are different formulas that can then calculate an adequate sample size that will help you in correctly interpreting your research findings and applying it to the entire population. So let's say your formula tells you that you have to ask 1200 patients. So you will divide the entire Peshawar city into, let's say, 12 different parts, and you say that uh, I'll go to each part and ask 100 patients from each different part whether they have hypertension or not. So what are you're basically doing a cross-sectional study, and at the end you say, let's say 400 out of let's say uh, 400 out of 1200 patients had hypertension. So basically, you can calculate the incidence from that, and I think it comes out to 33.33%. So you can say that the incidence or the prevalence of the prevalence of hypertension is 33.33% in Peshawar. So what you did here was basically you did a cross-sectional study. The important thing in a cross-sectional study is that there is no follow-up. So what do we mean by follow-up? Follow-up means is, how many times you interacted with your patient. When we are looking at patients, when we are dealing with patients in our clinics, basically let's say there is a patient with hypertension. You prescribe the patient some antihypertensive drugs. So you'll see the consultant, he'll tell the patient, come back after 4 months and we will see, is your blood pressure controlled or not. So this is what follow-up is. So if in cross-sectional study, usually there is no follow-up. generally speaking, there is no follow-up. So that is why it's sometimes called as a snapshot study as well, because it provides a snapshot of the population at a single moment in time. So, and from the topic, you guys can probably tell what are the uses of it. It can be used to guide, useful for guiding the development of public health interventions. And the advantages are that it is very quick and inexpensive to do. I don't know about quick, but it is inexpensive, that's for sure. Because you will be looking at uh, you will be looking at 1,200 different patients. So that is, I don't think that's very quick, but it is inexpensive, that for sure. If there's a lot of patients, then for sure it will be. If there are a lot of co-authors involved, then it will be quick as well. But it depends again on how you do it. So an example of a cross-sectional study is, this was a paper that was published in the Journal of Infectious Public Health Diseases, I think. And the title is Comparing the Attitude and Knowledge of Medical and Non-Medical Students Towards the Novel Coronavirus. So these are titles that you guys probably have seen in your WhatsApp groups. I think everybody is doing these type of studies. For example, let's say you want to look at the impact of sleep duration on academic performance. So this is something that can be done very effectively using a cross-sectional study. So first of all, as we said, research is something that you have to do systematically. The question is, does sleep have an impact on academic performance? And you're trying to answer it, but you have to do it systematically. So first of all, you will do a literature review. You will look at are there any other papers that have already addressed this issue? If yes, then you can look at the methodology, and you can, try to replicate the methodology that they use, and employ it in your setting, in your medical college or in your city or in your country. And or if there are no such researches, then you can go to there are guidelines for every disease, I think. There's a sleep society, and they probably have guidelines for that divide sleep into different categories. So let's say you categorize less than 3 or 4 hours of sleep as very poor sleep, then between 4 to 6 as moderate, and 6 to 8 as that is a good amount of sleep, and more than 8 is even better. So then you will ask students how many times did they sleep the past week. Or it depends on your criteria, what your criteria is. First, you will write a proposal. You'll get that approved from your institutional review board, and then you can, start doing your research. You can ask students how many times did they sleep in the past month or in the past week, depending on your proposal, your criteria. And then you can ask them what was their performance in the most recent academic examination, and then you can use different statistical tests to determine whether there's an association between the sleep duration and academic performance. So off the top of my head, the tests that, there are many different statistical tests, many different softwares that can be used to, calculate these associations. The most common one is SPSS, and I think the test that would be, employed in this particular case would be the most appropriate test, I think, would be ANOVA. That can then tell you, whether there's an association between sleep duration and the academic performance. And these tests and the softwares are things that you guys will learn in the upcoming webinars. So the second type of study is case control study. Now the cross-sectional studies, case control studies, and cohort studies, these are also called as observational studies, because you are generally not doing anything on your own. You're simply observing patients. So that's why they're called observational study. In some studies, you are performing an intervention, you are performing an experiment, and those studies are studies that are interventional. And if you're performing an experiment or something that has not been approved yet, then those are clinical trials. So case control study is, let's first read this and then I'll give you guys an example. So case control study compares people who have a disease of interest. So these are cases. And then there are people who do not have the disease, and these are controls. And we identify potential risk factors associated with the disease. And by comparing prevalence of risk factors between cases and controls, researchers can then determine the association between the risk factor and the disease. So the case control study is quite similar to a cohort study. There is a slight difference between them, but generally speaking, case control studies are used for studying rare diseases and the potential risk factors for rare diseases. So I'll give you guys an example for a not so rare disease. Let's see, let's talk about, lung cancer. So most of you guys probably know smoking is associated with lung cancer, but let's assume we don't know smoking is associated with lung cancer. So there's a question, is smoking, there's our question, is smoking associated with lung cancer or not? So now, using this, what we just read, we must have two groups, one that has a disease of interest and the other that does not have the disease of interest. So the disease of interest is obviously lung cancer. So we will have one group, and this will include patients with lung cancer, and the other group will be controls. These will be patients who don't have lung cancer, who are, uh, but the two groups should be matched for other variables. For example, they should have a similar age, they should be of similar gender, the distribution of gender, the distribution of various comorbidities should be similar, because we are studying, smoking particularly. So we want to isolate that risk factor from other risk factors. And this thing, making sure that both groups are, similar, they have a similar distribution of characteristic, this is called as matching. This is a term that you guys probably will come across different studies that you guys read. So this is something that you guys should know. Matching refers to this, that you are controlling for other factors. So now we have two groups. We have one group who has lung cancer and the other group that does not have lung cancer. Now we'll ask the patients with lung cancer, we'll ask them how did you smoke in let's say in the last 10 years, and how many packets did you smoke per day? And they, let's say there are 40 people in each group, and 30 out of 40 say that we smoked that we were smokers. And then in the control group, 10 out of 40 say that they smoked and the rest did not smoke. So now we can tell that the prevalence of smoking is much higher in the group that has lung cancer as compared to the group that does not have lung cancer. So we can say that there may be an association between smoking and lung cancer. And again, you have different tests that can then determine whether there is an association or not. And there are several different measure of effects that you guys will learn in the upcoming webinars as well. So the measure of effect that is used for case control study is odds ratio. Odds ratio refers to, you guys can think of it as probability. Probability that a patient that a patient with lung cancer smoked is much higher as compared to the probability that a non-lung cancer patient smoked. So this is something, this is what an odds ratio means. So if the odds ratio is more than one, it means that, that smoking has an association with lung cancer. This is stuff that you guys will learn in the upcoming webinar. So, don't worry if you guys don't understand it right now. You guys should just know what a case control study is. Simply put, there are two groups. One has the disease of interest, one does not have the disease of interest. And then you measure exposure retrospectively. And what was the exposure? Smoking was the exposure. So you looked at how many patients were exposed to smoking, 30 out of 40 in the patients with in the group with lung cancer, and 10 out of 40 in the group that did not have lung cancer. So, using your statistical tests and using your analysis, you came to the conclusion that, smoking may be associated with lung cancer. And an example would be this, I came across this study, aspirin use and risk of pancreatic cancer. So, now you guys should think what should be the two groups in this case. What is the disease of interest? The disease of interest is pancreatic cancer. So we'll have two groups. One group has pancreatic cancer, the other are controls that don't have pancreatic cancer, but they have a similar distribution of other comorbidities. They are of a similar age. They are the gender distribution is similar. Other comorbidities are similar. And then you ask patients with with the pancreatic cancer, how many of them used aspirin, and you ask it in the control group as well. How many patients use aspirin, and then compare. And then if the prevalence of aspirin use was higher in patients with pancreatic cancer, then you guys can say there may be an association between aspirin use and pancreatic cancer. If the prevalence was same, then you can say that aspirin use does not have an association with pancreatic cancer. So that depends on your findings. And now we're going to talk about cohort studies. So cohort studies is quite similar to a case control study. In case control study, we had outcome of interest at the very start. We had two groups, patient who had the outcome of interest and patient who did not have the outcome of interest. And then we compared the exposure, the how many patients were exposed to the that particular risk factor that we are addressing in both groups. In cohort study, we started in a different way. Basically, let's say we're doing the same thing. We are trying to find out the association between smoking and lung cancer. Again, we'll make two groups. Let's first read what the text says. The text says follows a cohort study follows a group of individuals over time to investigate the relationship between an exposure or risk factor and a particular outcome or health condition. So now we are basically studying exposure. We are trying to study is the exposure associated with a disease or not. So what is the exposure? The exposure is smoking. So now we'll make two groups. Group one are patients who are smokers, and group two are patients who are non-smokers. Then using a prospective design, we'll follow these patients for 10 years, and we will see how many patients in the group one who are smokers, how many of them develop lung cancer, and then we look at the other group two, who are non-smokers, how many of them develop lung cancer. So we'll check the prevalence in both groups, and if more people in that group one, those who are smokers, develop lung cancer, then we can say that smoking has an association with lung cancer. So if you guys compare it, this seems like much more difficult to do. If you're going to be following patients for 10 years, that is like by that time probably that research title may not even be relevant. So in that case you might want to do a case control study, or you might want to do a retrospective cohort study as well. There are two types of cohort study: prospective and retrospective. Prospective is when you follow patients. And what did we mean by follow up? We meant basically we are looking at patients multiple times. For example, you interacted with a patient at day 1, then you are interacting with that patient again at day 20, because you want to check whether that person developed the disease or not. So you want to follow up with that patient. So that is so if you're doing it in a prospective way, that is you are doing it you're going to be following with the patient in the future. Let's say 1 year into the future, you will be checking whether that patient developed lung cancer or not. This is a prospective design. Retrospective is something where you go back and you look at the patient. You are basically you're in the future and you're looking at the patient in the past tense. So how does this happen? It might sound weird. So basically nowadays, this is something that is common practice in developed countries, but that is not that common in our country, but it is something that is being developed. So all patients, when they come to the clinic, their medical records are, they're recorded. There's a proper patient file, and everything is written. Whether that patient is smoking. Does the patient have family relatives who have cancer or not? Does the patient have hypertension? All of the comorbidities are mentioned. And then in developed countries, these things are, and even in, I would say in KTH, this is something that they're doing right now as well. So this is something that these type of studies can be even done in KTH in the future, if they develop it, in a better fashion. So all of the medical data is recorded in the computer. So if you have access to that data, you can, look at patients who were smoking 10 years ago, or 20 years ago, and patients who were not smoking 20 years ago, and look at the present, the most recent follow-up that they had, and check how many of them had lung cancer. This is something that can be done instantaneously. And these are, I would say, one of a very this is quite a good study design. These are the type of studies that I do usually. Most of my studies are retrospective cohort studies, and these are studies that I've published in quite good journals. So this is something that you guys should keep in mind. Retrospective cohort studies can be really good, and they have a very strong evidence. If you guys remember the pyramid, cohort studies come above cross case control and cross-sectional study. So they have the strength of evidence is uh, quite significant. And some examples would be, this was a paper that we wrote that looks at rheumatoid arthritis associated cardiovascular mortality in the United States from 1999 to 2020. So as I said, this patient data is not very well recorded in our setting. So but you guys can use US data if you guys have access to it. Some databases in the US are publicly accessible. So, you will be sitting in Pakistan, at your home, and you will be able to access publicly available data in the US, and you can do a research on that as well. So this is something that can be done, so you can't really say that, because we don't have we don't have availability of patient records in our setting, that you can do this particular research. You can do every type of research. All it takes is initiative. So this was a very recent study, just published. And this in this study, we were evaluating gender-based disparities in the outcomes of Impella use in acute myocardial infarction patients with cardiogenic shock. And again, insights from real-world global data. So by real-world global data, we again mean, these patient records, electronic patient records that are available on the computer. So I'll just briefly describe this paper. Basically, what is Impella? So Impella is a left ventricular assist device. So sometimes when patients have myocardial infarction, they can develop heart failure or cardiogenic shock. So what does that mean? What does cardiogenic shock mean, or what does heart failure with reduced ejection fraction means? Basically, it means that the heart is unable to pump blood. It is unable to meet the requirements of the body. So these patients are very high risk patients, and they can undergo decompensation very quickly. So you have to really be very vigilant with these patients. So recently, I would say not very recently, but relatively recently, there have been many mechanical circulatory support devices that have been approved for such patients. One of them is Impella. It is a left ventricular assist device. It is basically a pump, artificial pump. They insert it in the heart, and it helps the heart pump blood. So it improves the stroke volume, and it improves the patient's conditions. So it is associated with reduced mortality. So we wanted to check whether gender has an impact on outcomes in patients who underwent Impella implantation and had, cardiogenic shock secondary to myocardial infarction. So we had two groups. Again, as we said, in cohort study, there are two groups. The exposure, but there are, in this case, the exposure is quite unique. The exposure is gender. So, one of them could be your case, your exposure, and the other could be your control. So for us, let's assume males are the control and females are the exposure. So we compared outcomes in these patients, in cohort study, again, we are measuring outcome of interest. So what could be the outcome of interest? Obviously, outcome of interest in such studies is mortality. It is, heart failure exacerbation, hospitalization, acute kidney injury, and a few other outcomes. So basically, we found out that, generally speaking, outcomes were comparable. There was no difference in mortality, but the incidence of acute kidney injury was much higher in patients who were males as compared to females. And then the female patients had a higher risk of vascular injury as compared to males. So this was our findings, and it got published in a good journal. So this is definitely retrospective studies are something that I would suggest should be on everyone's radar. These should be studies that that you guys do, because these are very easy to do, and they can get published. Another example would be this, this was a study that we did. We compared two drugs. Again, these are GLP-1 analogs, tirzepatide and semaglutide, on long-term outcomes in heart failure patients who have coexisting chronic kidney disease. So, we have two drugs. One group is exposed to, let's say, tirzepatide is the exposure. So one group was exposed to tirzepatide, and the control group in this case was semaglutide. And we want to measure outcomes of interest. Outcomes of interest were heart failure, hospitalization again, then mortality, acute kidney injury. Again, the thing is, most studies that are in the field of cardiology and looking at heart failure patients, they will probably have similar outcomes. So the ones that I discussed in the previous paper, pretty much the outcomes were the same, and we found out that tirzepatide was performed much better than semaglutide. Along, it was associated with reduced mortality rate, reduced heart failure hospitalizations, reduced acute kidney injury, and the other outcomes as well. So this was presented at a conference as well, and this is something that has been submitted to a journal as well. So now we have this was case control and cohort studies. Now we'll be discussing randomized control trials. So randomized control trials, so the studies that we're discussing up till now were uh, observational studies. We didn't do anything on our own. Basically, we were looking at patients who had, in the first study, in the Impella study, we were looking at patients who were males and females who underwent Impella implantation and compared their outcomes. In the second study, we were looking at patients who were prescribed tirzepatide and compared them with those who were compared semaglutide. Now, these are all drugs that have been FDA approved. There's an authority that approves drugs and that approves different treatments as well. Now, let's say there's a treatment that has not yet been approved. You're thinking that, let's say this drug, let's say, there's a new drug in the market. And for example, semaglutide, they were initially developed for type 2 diabetes and not for, weight loss. It was only later that clinicians found out that they cause weight loss as well. And now pretty much weight loss is the more important the more important outcome that even clinicians and both patients and clinicians look for when they are prescribing these drugs. So let's say you're looking at something that has not, you're looking at a drug that has not yet been approved. Semaglutide, for example, it has not been approved for weight loss. So you can't just randomly prescribe patients these drugs, because this is a doctor can't just randomly prescribe drugs to a patient. He has to follow guidelines. If a doctor is randomly prescribing drugs, then that patient can sue the doctor, and it can PMDC can take away the license. They can order an inquiry, etc. So you have to do everything through guidelines and through, as there's a very famous term, evidence-based medicine. So you want to practice medicine using an evidence-based approach. But you want to compare a drug, so how would you do that? You would do that through experimental studies. And the best way to do that is randomized control trials. There are many different types of experimental studies. There are quasi-experimental studies, non-randomized control trials, and then randomized control trials. And then there are single-arm trials, double-blind, double-arm trials, and then there's this thing called as blinding. There are single-blind studies, double-blind studies, triple-blind studies. So they are basically there's slight differences in all of these study design, but they offer the same. They follow pretty much the same approach. So we'll be discussing randomized control trials, and the other ones are pretty much very similar to this. So in a randomized control trial, you randomly assign participants into an experimental group or a control group. And the keyword is randomly. The only expected difference between the control and experimental group is the outcome variable being studied. Again, even in cohort and case control study, we mentioned that we want to make sure that the groups are matched. They have a similar distribution of comorbidities. But this is not a very stringent requirement in case control and cohort study. But this is something that is absolutely essential in a randomized control trial, because you want to make sure that all other variables are constant, and the only variable is the drug that you're studying, or the experiment that you're performing. So these are randomized control trials are the best way to study the safety and efficacy of new treatments, and they are required by governmental bodies as the basis for approval decisions. And most rigorous and robust research method of determining whether a cause-effect relation exists between an intervention and an outcome. So, let's learn what a randomized control trial is through an example. This was uh, perhaps one of the best, medical journals that there is New England Journal of Medicine. It publishes, the best quality articles. It has a very high impact factor, and this paper was published in 2021. So the title of the paper is Once Weekly Semaglutide in Adults with Overweight or Obesity. So so yeah. So we have our patient population is patients who are obese or overweight, and our experiment or intervention is GLP-1 analog, that is semaglutide. So looking back at the previous slide, we have two groups, an experimental group or a control group. So in the experimental group, we have patients who have obesity or overweight. We'll randomly assign these patients into the experimental group and a control group. And the experimental group is going to get semaglutide, and the control group is going to get a placebo. So what is a placebo? Placebo is basically, uh, it refers to control. Basically, you're either giving normal saline, or you're giving nothing basically to the other group, or sometimes you give the standard treatment. For example, let's say there was another drug for weight loss or obesity, so you will give the other patient group that drug. But in this case, the placebo just refer to normal saline. So you compare patients who received semaglutides versus those who did not receive semaglutide, and then you follow up with them. This is basically a prospective study design, and let's say you follow up with them very regularly, at 30-day intervals for a year, and you will check the weight loss in them, and you'll find out that patients who had semaglutide had much greater weight loss as compared to those who were not given semaglutide, who were given placebo. So that is what a randomized control trial is. And most of you guys would say, this is not exactly very relevant to us, because we can't do these things in our setting. But you'd be surprised, there are I know that I have, some colleagues who have done clinical trials, and they're in the final year of med school. I think there's some even in the fourth year of medical school. There's some who are doing training, and they have been part of randomized control trials as well. So again, it all depends on your initiative, because we have some of the most gifted clinicians and consultants that are practicing in our hospitals, and they have a lot of ideas. And you guys, when you guys look at different topics on PubMed or different journals, you guys can find out. You guys can come up with titles on your own as well, and you can discuss it with the clinician, and they will check whether it makes sense or not to do a trial on it, and then even a randomized control trial can be done at our setting, at public or private hospitals. I think there is even a dedicated clinical trial unit at Rahman Medical College. And there's a dedicated clinical trial unit at Khyber Medical University as well. So this is stuff that is happening. You guys just it all depends on the initiative. And this is stuff that you guys can be part of. I think last year we had a topic that we wanted to do in the field of neurosurgery. I think it was about, we were looking at patients who were undergoing laminectomy, and we wanted to see if, a dose of steroid medication and along with a dose of antibiotics would improve outcomes as compared to giving normal saline. But that trial did not happen. But this is something that you guys can study as well. This trial has other. I think this is something that has been published as well. You guys can compare whether intra-procedural injection of steroids, local injection, or intrathecal injection of steroids and antibiotics can improve outcomes in patients with laminectomy as compared to and you can the control group could be normal saline, you give placebo to that group or whatever the current standard is, and you can then compare outcomes over, let's say, 30 days or 6 months. So that was, randomized controlled trials. So now we'll discuss systematic review and meta-analysis. Perhaps this is the most, I would say, the most famous type of research, the one that, is being most actively pursued by medical students in undergraduate medical students, and I'm very it is very encouraging to see students who are doing and publishing these studies, because again, as I said, limitations does because just because we have some limitations in our setting does not mean you can do research. There are many different types of studies. One of them is systematic review and meta-analysis that don't require interaction even with the patient. You can do it at your home, from you can just you can sit on your bed and you can do this type of research. So let's just quickly go through the slide, and then we'll discuss what this is. So a systematic review and meta-analysis involves extracting outcome data from all relevant studies in the literature and combining the results of multiple studies to produce an overall estimate of the effect size of an intervention or exposure. It is considered a study of studies, and it can be conducted for a wide range of research questions, including evaluating the effectiveness of medical interventions, etc., etc. And researchers must, so this is a key point, researchers must carefully assess the risk of bias in each study to enhance the validity of the meta-analysis. So this is something that I'll come towards later, but let's discuss what systematic review and meta-analysis is. So, let's discuss it using an example. So this is, meta-analysis that was done by one of my colleagues, and they were looking at efficacy and safety of iaquinimod versus placebo in relapsing remitting multiple sclerosis, a systematic review and meta-analysis of randomized controlled trials. So, this was a novel drug that was, developed for patients who have relapsing remitting multiple sclerosis. So by relapsing remitting means patients who, are constantly developing episodes of multiple sclerosis. It is something that is happening, very frequently, despite adequate medical management. So these patients, there are no effective, I don't know if I don't think so there are any effective treatments for this patient population. So some clinical trials, they looked at iaquinimod for these patients, and those trials found out that iaquinimod can be, uh, uh, effective and safe for these patients. But the thing is, when you look at these studies, these case control, cross-sectional, cohort, and randomized control trials, even the thing is, you are directly interacting with the patient. So it is difficult to find patients who have relapsing remitting multiple sclerosis. Let's say, 10 out of every 1,000, or let's say 1 out of every 100 patients with multiple sclerosis has this relapsing remitting pattern. So this is a very small patient population. So if you're doing this clinical trial in a single hospital, or let's say in a single city, or even in a country, let's say there are 20 such patients in the entire country. So there is a chance that you may not be able to assess some of the rare side effects that may be associated with this therapy. For example, ACE inhibitors is a very common drug. I'm sure most of you guys have heard of it. So a rare side effect of ACE inhibitor is something is cough, but it is a very rare. It can only you can only tell about this side effect, and even there would be angioedema in patients who have a genetic predisposition. So you can only tell that ACE inhibitor is associated with these side effects by studying a very large cohort of patients. For example, let's say this side effects occurs in 1 out of 100 patients. So if you are looking at 20 patients, then the probability that you will observe this side effect is very rare. And let's say this side effect is very serious. It can cause, death, or it can, cause significant morbidity. So so it is very important that you are able to tell that this drug is associated with this condition, but you are not able to tell because the sample size is small. So in this case, meta-analysis, they come to the aid, and they basically change the game. They are game changers in this. Uh, an important quality of a research paper is the power of a research paper. Power refers to the strength, how reliable that the findings of that particular study are. And the power of meta-analysis is the highest because power is something that is pretty much directly related to sample size. The greater the sample size, the greater the number of patients in a study, the more confidence, the greater the confidence is with which you can tell that that these findings are that they are reliable, and these are findings that would if you observe it in the real world, you will come across these findings. So that is when what meta-analysis does. Basically, you combine all of the different researches on a particular topic. For example, I think let's say there were three studies, there were three clinical trials that looked at iaquinimod in patients with relapsing remitting multiple sclerosis. Let's say one clinical trial had 20 patients, the other had 30 patients, the other had 50. So what these authors did was that they combined all of these trials. They extracted data from all of these clinical trials and did their own study. So now they have 100 patients, and they did a study on that. And again, they did not have to go and interact with the patient. They were just basically, sitting in their own homes, and they did this study, and they found out that, let's say that Equinamod is effective and safe. And going back to the research pyramid, this is the strongest type of evidence for iaquinimod for prescription in patients with relapsing remitting multiple sclerosis. So that is what meta-analysis is. A systematic review is very similar to meta-analysis. So this was a systematic review that we did. And this is a systematic review of case reports. Again, meta-analysis and systematic review can be done for all types of research. You just have to make sure that the the researches are comparable. Again, even in cohort and case control studies, we wanted to make sure that the two groups are comparable, because we want to make sure that we're doing everything in a systematic way, and we are actually looking at risk factors rather than other variables that we are not accounting for. So the same principle would apply to systematic reviews and meta-analysis. We want to make sure that the articles or that the research papers that you include in it follow a similar study design. They have a similar inclusion exclusion criteria, and only then can compare. Then can you pool the data. For example, let's say one group is looking at multiple sclerosis in patients who are 30 years old, and the other is looking at multiple sclerosis in patients who are 50 or 60 years old and have heart failure and multiple other comorbidities. So in that case, these two groups may not be as comparable as you would like, and in that case, you might think twice before pooling these two studies. So, when you do a meta-analysis, the way that you collect the studies, you want to include all of the studies on a topic. For example, if in the case of iaquinimod for multiple sclerosis, you want to include all of the different, and this was a meta-analysis of randomized controlled trials. So you want to make sure that you include all of the different trials on it. So you do a systematic search of various different databases. One of them is PubMed. You guys can see there's these studies are all indexed in PubMed. PubMed is a database that stores research. Then there are many other different types of database. I think there's Cochrane database for trials as well. There is Embase, there is Scopus, and many other databases. So you want to make sure that you look at all of these databases and include all the different researches on a topic, combine them, and then go through them, make sure that these are relevant, that they satisfy the pre-designed inclusion criteria, exclusion criteria that you specified. Again, there's a proposal for it. Before you do any research, there's a proposal, there's a synopsis where you mention that I'm going to be doing this, this, this. So the same principle applies to meta-analysis. You have a proposal and which states that you have this, your inclusion criteria is this, your exclusion criteria is this. So if those studies satisfy your inclusion criteria, then you can include it. So this entire process, this is called as a systematic review. And when you perform analysis, when you pool all of these patients and you perform analysis using various different softwares, there's Strata, there's R, there's RevMan, there's comprehensive meta-analyst, you name it, there's many different softwares for performing meta-analysis. When you do analysis, you apply statistical tests, then it is called as meta-analysis. And if you don't perform any analysis, then you simply call it systematic review. So in this case, this was just a systematic review. So basically, we came across again, these were cases in our own hospital, congenital perineal hernia. This is a very rare condition. I think in our systematic review, we were only able to find out, I think, 15 or 16 cases that have been published worldwide. So it's a very rare condition. And we found out that there were two cases, and those cases were in two siblings. So initially we wrote a case report on it, but then we thought that this is a very rare condition. Let's pool all of the different studies that are present on this topic. So we looked at PubMed, or we went through the different studies that are in PubMed, and we pooled all of the cases all of the studies that had congenital perineal hernia, and we also went through Google Scholar and compiled them and discussed them in one paper, and basically that was what we did, and it is called as a systematic review of case reports. So that is what a meta-analysis is. So again, research hierarchy, systematic review and meta-analysis are at the top, and at the bottom we have case reports and case series. But an important note that I want you guys to, keep in your mind is that this graph is for evidence. It refers to the strength of evidence evidence that these studies have. It does not in any way, specify which type of study is better. So at the end of the day, if you ask, 100 people which type of study is better, so I think 100 out of 100 would say that clinical trials are the best form of studies, because these are studies, that lead to, FDA approval of drugs, and, these are studies that basically lead to, guideline changes in guideline policies, new drugs being introduced into the market, etc. So clinical trials are the best, and it all depends on what you are studying. A case report or a case series is a very good study. It is a very good publication. It can be published in the highest of impact factor journals. It all depends on how rare that case is, and how clinically relevant that case is, and how you have written that case. So in no way does it mean that if you wrote a meta-analysis, that you will publish in a higher impact factor journal as compared to, if you wrote a cohort study or a cross-sectional study. I think this iaquinamide, so sorry. So iaquinamide, this Journal of Internal Medicine Research. So I think this has a lower impact factor than this congenital perennial hernia. And this was only a systematic review. It got published in a higher. So it all depends on, and even those cohort study that I mentioned to you guys, the one on Impel, I think it got published in a higher impact factor journal. And the case reports. So it all depends on, how relevant that topic is, and how you approached it, and how you wrote it. So that is the different types of research designs that I think are relevant, that you guys will come across in your research journey. The most common types. For each type of study design, there are many different subclassifications. For example, for meta-analysis, there are meta-analysis of cross-sectional study. There are single-arm meta-analysis. There's this thing called as Bayesian meta-analysis. Then there is this thing called as network meta-analysis. Then there are you can do, a trial sequential analysis, time to event, I think, analysis. So these are all different, sub-classifications. You're just basically doing slightly more. You're doing slightly different type of analytical techniques. You're employing slightly different types of tests, and the research changes. But broadly, these are the different types of studies. Now we'll talk about research paper. So most of you guys probably already know what research paper, what are the different parts of a research paper and how to write one. We'll just briefly go through, a sample research paper, and we'll go to the different and we'll go through basically the different parts of a research paper. So the first part that you see would be an abstract. The abstract is a summary of the entire study. You basically summarize the findings. You say, I was studying this condition, and I used the following methodology, and these were my results, and this is my conclusion. This is what an abstract is. Basically, you're giving a summary of your entire research. Then the proper research paper starts. In the introduction, you explain the background, the rationale, why are you doing the research, and what are your objectives of the study. In the methodology, you write how the study was conducted, including study design, participants, data collection, and analysis. In the results section, you present the key findings of the study, often with tables and figures, and in discussion, you interpret the result and compare them with previous work, explore their implication. This is a very important part, because whenever you do research, you want to talk about other other similar researches that have been conducted. Because at the end of the day, when you are doing a research, you want it to generate a conversation among clinicians. It should that is this something that should be done for the patient, or is this something that should be that a clinician should have in mind when they are prescribing a particular drug. So this is something that we talk about in the discussion section. Then limitations. You acknowledge the weakness or constraints of the study. So most of you guys probably remember in the letter to the editor, I said, there's a type of letter to the editor that is called as, in which you are critiquing a research that has been published. So you want to avoid your paper being that you want to avoid being on the receiving end of a critical letter to the editor. So how do you avoid it? You basically write the limitations. You say, these were the limitations of my study, and the thing is, they can't really say it because you said it on your own. You said, these are the things that that I did that might impact my results. But this was the reason that I did that. This was the due to let's say the constraint of my settings. For example, in our clinical setting, we can do very comprehensive evaluation of a patient. You can say due to patient load, whatever, or due to budget constraints, or due to social demographic variables, we weren't able to address this concern, or we use this methodology. So basically then no one can point out that you made this error, or you made this problem. And this is something that is very good for peer reviewers as well, because peer reviewers, as I said, it can be quite a headache. So peer reviewers, they like to point out small problems in research. So when you mention it in the limitation section, and given that that limitation is acceptable, no, you can't just say, okay, you make a huge blunder in the methodology and you just say, this was a limitation. This is not something that is acceptable. The limitations have to be, within reason. So it will help your chances with peer review as well, because the peer reviewer won't be able to, say that, this is something that you should work on. They already know that this is a limitation and this limitation cannot be addressed. So they can just say, okay, this is a limitation, but this is a good study and you can publish it. And then at the end, you have a conclusion. Conclusion summarizes the main takeaway and potential future directions. So now I will discuss, we'll just quickly go through a sample research paper really quickly and just see what are the different types of research paper. I'll share my screen in a second. All right, let me just pull that up. All right. All right, I hope my screen is visible to everyone. Okay, so this was one of those cohort studies that we did. Again, it was gender-based disparities in the outcomes of Impella use in acute myocardial infarction, patients with cardiogenic shock, insights from real-world global data. So the first thing that you see is, abstract. The abstract has, it quickly summarizes what was the background. The background was that, these devices are being increasingly utilized for cardiogenic shock in patients with AMI. And what was the rationale? The study aimed to evaluate gender differences in clinical outcomes. And then you want to briefly describe what were your methodology. This was a real world data. You use this database. All patients, again, as I said, you can do analysis without patient interaction using publicly accessible databases, and you can do it at your home. So all patients with CS, cardiogenic shock secondary to MI, who underwent implant implantation were identified, and then they were divided into two cohorts based on gender. Again, as I mentioned, to minimize selection bias, propensity score matching was applied. So this basically means that the only difference between these two groups was that one were that the first group was male and the second group was female. So we wanted to make sure that the groups are comparable, and you just quickly go through the outcomes, and then these were the results. These were the number of patients after propensity score matching. This were the number of patients, and male gender was associated with significantly increased incidence of AKI. And readmission, on the other hand, females had a 60% greater chance of developing critical limb ischemia compared to males. And there was no difference in the incidence of for other outcomes such as cardiac arrest, ischemic strokes, pulmonary embolism, and mortality. So I'm being told that I have to wrap up the presentation because we have to move to question answers. So I'll just we'll quickly skim through this. So this is the conclusion section of the abstract, and now we have the main paper. Again, this is the introduction where you basically discuss the background information, and then then you talk about what is the rationale, what are the aims of the study. Then you talk about how did you do your research. So you have to, again, research is very systematic. You have to mention everything that you do, and to make sure that it is something that can be replicated. So this was our study population, and this is you can make very nice diagrams, nice figures, and they can really improve the chances of publication into a high impact journal. So this figure basically summarizes the entire study. It talks about the outcomes. It talks about the inclusion criteria. It talks about survival. Everything is summarized. Then again, this is our inclusion criteria using another figure. Then we talk about what our outcomes were and what were the statistical tests that we performed. So this is something that statistical tests are something that you will learn in the upcoming webinars. There are things called as measure of effects. Basically, you want to quantify the difference between two groups, and this quantification can be done through different techniques, and these are measure of effects. And one of the measure of effects is risk ratio. Another is odds ratio. Another one is hazard ratios that can be calculated using Cox proportional hazard and Kaplan-Meier analysis. So again, we talked about how we did the propensity matching. We talked about, and then you mentioned the results. So this was the baseline criteria. So basically, the p-value, the lesser the p-value, if the p-value is less than 0.05, it means that the two groups were different. So before matching, if you guys can see, before PSM, the p-values were less. They are less than 0.05. So these two groups are different. But after matching, these groups are very similar. Again, none of the p-values are less than 0.05. So this means that these patients, except one, BMI was higher in females as compared to females. Other than that, all the different variables are accounted for. So that is something. So we can say that this is a well-matched cohort. Again, then we talk about your outcomes. Really quickly, here I'm basically expanding on every outcome. So this is something that you guys can read at your own time. And then you talk about the discussion. Discussion is the most important part of a research paper. It can really elevate your research paper if you write it in a good manner. And again, look at this huge limitation section. This is something that we mentioned, and this is something that has been published in a very good journal. So findings should be interpreted in the context of several limitations, and these limitations are inherent to analysis relying on large administrative databases. So we are basically saying, that there are limitations, but these limitations are, due to the database that we are using, and they cannot be accounted for. And then we just mentioned the different types of limitation. And at the end, we have conclusion, and you can just talk about if there's some extra data, you can include it as a supplementary material. And then there's acknowledgement, abbreviation. These are just, this depends on what the requirements of a journal are. But the main parts of a research paper are, this abstract, intro, methodology, results, a discussion, and conclusion. So with that, we conclude our session, and we'll move to question answer session. You guys can ask any question that you guys have, whether it is relevant to this webinar or whether it is not, but as long as it is relevant to research. So Wajahat, can you
Muhammad
begin
Ahmed,
the
a
question
few,
answer session?
yes, Muhammad Ahmed, a few questions that popped up in our chat box. A few of them were answered by Dr. Jehan. Thank you, sir, for that. One of them is still unanswered. I will ask that. Why there is no follow-up in a cross-sectional study?
Why is there
That's the
no
question.
follow-up? So, okay. All right. So basically, that is the study design pretty much. That is, if you were, let's say you're looking at the prevalence of hypertension, you are in prevalence of hypertension, you don't need follow-up. You're looking at the patients at one point in time. Let's say, in Khyber Medical College, we are looking at how many students have hypertension. So you just go to each student and ask them, do you have hypertension or not? At one point in time, you don't have to ask them, 1 month later. do you have hypertension or not? Because that is not relevant. You're just looking at the prevalence. What is the prevalence? If a person has hypertension, they will have hypertension. Either it will be controlled or it will be uncontrolled. But they are going to have hypertension. They are probably going to be on medications, and it is something that they are going to have. So that is why you do it. There's no follow up. That is why you just do it at one point in time. And this is basically the design. Uh, Cross-sectional studies, if you do a research that does not have a follow-up, then it falls into the category of cross-sectional study design. It's as simple as that. I hope you know that answers the question.
Yep, exactly. Like
Is there any other question?
in simplest way, a cross-sectional study just checks the prevalence of something in a group of people. And like for follow-ups, we have cohorts. Exactly, Muhammad Ahmed. If
Thank you.
any, if someone wants to ask a question, you can raise your hands and it will be answered right now.
So a person asked, why is this design particularly useful for studying rare diseases? So I mentioned that case control studies are studies that are particularly used for rare diseases. So what is the reason for that? That is a very good question, Hashim. So the reason is because in rare diseases the number of patients are less. So if you in cohort studies we had two patients. Let's say you're looking at, let's assume lung cancer is a very rare condition. Let's assume it is, even though it's not a very rare condition, it's a pretty common condition. But for the purpose of this example, let's assume it is. So let's assume 1 in 100,000 people get lung cancer. So if you have a group, if you're looking at the association of smoking with lung cancer, and you have a group of 100 people, and the other group is people who are controls, then it is very much likely that none of the patients develop lung cancer, just because it is a very rare disease and you follow the patients for 10 years, but none of them develop lung cancer, even though smoking has an association. So for this reason, you do a case control design. In case control, I said you already have the outcome of interest at the start. You are simply looking at patients with lung cancer from the start. You have two groups: patients with that rare disease, let's assume lung cancer is very rare, and then patients who do not have that rare disease. And then you look at the risk factor. How many patients were smokers and how many patients were non-smokers? So let's assume there are 100 people, in the entire country that have lung cancer. So you can just do a research study on those 100 patients and check how many of them were smokers versus how many of them were non-smokers, and you can tell if there's an association between smoking or not. So that is, I hope that answers the question. You want to, because the number of patients is low, that is why you want to do a case control study design. What type of study should we do in case series? So case series is something, you come across a similar type of disease in in a particular patient population, or you do a similar type of intervention in a particular patient. So from my own experience, I can tell you guys, at our hospital, we our hospital does bariatric surgeries, and they do and what is bariatric surgery? Basically, bariatric surgery is a type of surgery in which it is a weight loss surgery in which you reduce the surface area of the digestive tract, thereby reducing the amount of nutrients that are absorbed. So it causes weight loss, and there are different techniques for this bariatric surgery, and these techniques were developed by surgeons. So there's a doctor at our hospital, Dr. Zareen. He's a very qualified doctor, a great doctor, and a great researcher as well. And he basically was doing, this a specific type of bariatric surgery, and he wrote and he did the same intervention. Basically, he did I think it was gastric bypass, or I think it was gastric bypass or gastric banding, and he did this procedure. and on the, on a group of patients, let's say there were 10 patients. So he wrote a case series on it and said that, these were the patients that we did this procedure on. He explained what the procedure was, and then he talked about, that the procedure was safe and there was no adverse events, or whether if there were adverse events, they were, dealt with using the, so and so approach. So this is a case series. Another case series could be, the example of congenital perineal hernia. You can, if there are similar cases, you can write a case series on that. So there were 10 patients who had congenital perineal hernia. That can be a case series. So anything in which the patients are similar or the intervention is similar, and you're not doing any analysis. That is pretty much what a case series is, or you can even call it a descriptive study, but this is something that you can do a case series on. So I think we had one person, I think Zalan. Do you want to ask a question?
Yes, he actually dropped it in the chat box. I'll narrate it. How to take initiative of doing a research if there is no environment of research, no mentors in a medical college? Can we start by our own, by a group of 4 to 5 friends without any mentor?
Absolutely, you can start it on your own. At the start, Dr. Suleiman Ilahi, he said that, the journey of 1,000 miles begins with a single step. So the thing is, at the start, definitely it is much more easier if you have, mentors, if there is an environment of research, that it gets very easy to do research. But if there's no environment, for example, at the time that I was doing research, I'm in final year now. When I started doing research, I was in second year. There was no environment of research, and we had to learn things on our own, and we had some very we're very thankful to our faculty, Dr. Jehan particularly, and the entire community medicine department. They helped us, but most of the stuff we had to learn through trial and error. So most of the studies that I did initially were cross-sectional studies or cohort studies, and those were studies that in retrospect I found out that there were, huge mistakes that I did in those studies, and I published none of those studies. They're still with me as a reminder of, the challenges that we face. But it's fine because those were essential for learning, and it is the reason that is the reason that you get into research. But definitely, if you have mentors, then I would suggest reach out to them because it can make life very simple. But if you don't have mentors, then it will definitely be challenging, but it is possible. There are so many different webinars on YouTube. You can find out even this SRC webinar. There are I think we have a webinar on case reports as well, that you can read, and you can just follow those guidelines and do your research on your own. I think Dr. Iqbal wants to add something. Dr. Iqbal, please, you can unmute your mic and add. Dr. Iqbal, you're not audible.
Hello, Assalamu alaikum.
Walaikum assalam, sir.
Excellent work, Ahmad.
Thank you, sir.
So hopefully all the other speakers will follow your footstep, and inshallah it will be an exciting series. So just all the appreciation from my side, and this is the bottom line message from my side.
Thank you, sir.
Thank you, sir, for joining us in this busy schedule, sir. आप सारा time इधर थे. Thank you so much for this. We're really grateful. Have a nice day, sir.
All right. Thank you. If you don't have any other research questions, then I think we can conclude the
No, we
session.
have Muhammad Ahmad.
Yes,
We do have
okay.
2 questions left.
Okay.
And yes, Muhammad Zalan, I think if you don't have an environment of research in your college, or mentors in a medical college, I think you can go to LinkedIn and make your profile there, and there you can connect with a lot of researchers. That would be a very good option for you, and you can just ask them to include you in a medical research. That would be very helpful. Acha, we have another question. How can we do RCT in the field of dentistry?
Can you repeat it, please?
How can we do RCTs in the field of dentistry?
So how can we do RCTs in the field of dentistry? So, I'm not very familiar with the field of dentistry, so I wouldn't be able to give you an exact, way. But the thing is something similar. When I was in second year, so I was very, enthusiastic about doing research. So I went to a senior, or went to who was in final year, and I told them, I want to do this RCT basically. That we were comparing anesthesia. We said that we would compare uh, you know uh, and I think so. The thing is, I think it was local anesthesia versus systemic or something anesthesia in patients with gallbladder who are undergoing gallbladder surgery. So you can do something similar in the field of dentistry. Let's say, I think before you guys extract do a root canal or anything, you give anesthesia, right? So you can just compare two different types of drugs. Let's say I don't know which drug that you guys give most commonly. For example, most common drugs are probably NSAIDs. So you can compare one type of NSAID with another, or you can compare, and then you can compare them by using post-operative pain. And there are different scales that quantify post-operative pain. Or you can give let's say give a steroid prior to tooth extraction, and then check whether that impacts healing or not. These are things that I don't know whether if they are clinically relevant or not. This is stuff that you have to search on your own, because I don't know exactly. Or you can just ask your professors. They probably know what is relevant or not. Just go through how can we okay, you can just ask your professors, and they'll probably give you an idea as well. Or just write RCT, randomized control trial, and just write teeth, or just write whatever, tooth extraction, or dental infection, and you will come up with there will be a lot of different RCTs. Just write this on Google, search this on Google, you will find many different RCTs. So just take one, whichever one is the easiest to perform at your setting, and just replicate it in yours, because we have a very unique patient population. So it doesn't matter if it is previously published, you can do it again. But the thing is, the important thing about RCT is that you have to take prior approval. It is a very you know comprehensive process, so you have to make sure that you follow all of the different guidelines. There's a repository where you have to publish your proposal, and you have to make sure everything is accounted for. So you have to make sure you address all of the different variables. So if an RCT is the first study that you're going to be performing in your research, then I would suggest don't go for that. First, you should do a cohort study, or a case control study, or even a cross-sectional studies, just so you know how to interact with patients, how to take patient data, etc. After that, move on to RCT. So I think Zalan asked another question: how can we start on our own? So basically, again, it is all about initiative. Just look at what field are you interested in? Are you interested in medicine, or are you interested in surgery? Uh, Even if you guys were careful, if you were listening carefully, paying attention, I give you guys some suggestions. For example, if you're doing a cross-sectional study, you can look at the prevalence of vitamin D deficiency. This is something that tests are being performed at our hospital. You can look at this. You can check for vitamin D deficiency in patients who have diabetes, patients who have, bone pain, etc. Then you can check for, let's say, the risk factors, or, the determinants of factors related to diabetic foot infection in patients with diabetes mellitus. You can look at different determinants. Determinants. This is a classic cross-sectional study. You can do a cohort study by, uh, uh, checking, HbA1c. Let's say you have two groups. One has the exposure is HbA1c. The high HbA1c is the exposure. So there's one group with high HbA1c, and then one group with low normal HbA1c values, controlled HbA1c values, and you follow them, and you can check the incidence of diabetic foot ulcer. So this is something that is, I would say, not very clinically relevant, but it is something that can be done and can be published in a local journal. And this is how ideas are formed. Ideas are formed by, you can when you study, when you're reading your book, or you're going through, just go through PubMed, just go through Google, and you will come up with ideas on your own. You can ask your, you can do this study, this impact of sleep on what was it, on academic performance. This is something that can be done in your own field. And the thing is, when it comes to the data analysis, if you don't know how to do data analysis, there are dedicated courses free of cost that are available on YouTube. And we have ChatGPT as well. You can take help from that. You can tell ChatGPT, I did this research and I have this group, I want to check the the association of sleep duration on academic performance. And I have this type of data. What test should I perform, and how do I perform it? Basically, ChatGPT will tell you exactly how to do that test. So it's very simple. It's all about initiative. Just go through YouTube videos. And if you are studying at a university, doesn't matter which college you are studying in, every college has a community medicine department, and those teachers definitely know what they're teaching. All of them know about research. At least the basic research is something that every teacher knows, and they even know the high quality stuff that most of us don't know as well. So they can give you guidance, and it will be fine. It's definitely fine if you are doing it on your own.
Muhammad Ahmad, we have a last question. How significant is the first partnership in terms of series? Let's say the research group has 8 members.
So I wasn't able to, pick the question. Can you write it in the chat?
But Jahad, there's some problem with your audio.
You can just write it in the chat, and I'll just read it from that. How significant is first authorship in terms of CV? Let's say the research group has 8 members in it. So the thing is, this question depends on, who are we talking about? Are we talking about someone who does not have any published research, or are we talking about someone who has 20 papers or 30 papers? So if you are someone who has, let's say, 2 or 3 papers or so, then I would say that first authorship has an impact. Definitely, it shows that it was your idea, it was your because the first author is usually the one who came up with the idea and did most of the work. So definitely, it's important. You can't negate the importance of first authorship. And nowadays, I think even program directors and people are paying attention to the number at which your name is mentioned in the author block. So first authorship is important, but only if you already have, let's say, 3 or 4 papers, then it's important. If you don't have any paper, then any authorship, last authorship is great. Just go for it. Go for any opportunity that you find. Once you have a couple of papers, then you can start looking at first author. Don't fall into, this trap of, trying to being the first author. It will, in most cases, you will end up with no publication. So if there's a good group that you have, or good, seniors or mentors that can guide you, and they can, they'll give you, let's say fourth, fifth, or whatever eighth authorship position, go for it, learn from them. And once you learn everything, you can do your own research.
Thank you, Dr. Mohammed Ahmed. We have Dr. Jehan in the chat. Dr. Jehan, if you kindly want to say a few words, members, this way is all yours.
So, Dr. Jahan, would you like to add a few words before we conclude?
I'm driving right now, but I was listening to every one of you. Alhamdulillah, I'm confident of Ahmed's ability. I was trying to answer a few questions in the chat box, but right now, is there any question left for me?
No, I don't think so.
Questions left. We just wanted to hear a few comments or remarks if you had any.
Sir, you can sign off. Thank you so much for joining us. We just want to say thank you to you for joining us this whole time.
Sure. Thank you so much, SRC team. We are all confident on you. It was indeed Muhammad elaborated. Listening to him, I had screenshots as well. I liked his presentation. Few slides were very much awesome, and we learned from each other. Okay, so it was a good start, and we prepare for the 3rd August webinar. Thank you so much, my dear SRC.
Thank you, sir. Thank you, inshallah.
That brings us to the end of today's session. Heartfelt thanks to Muhammad Ahmed, our respected guests, the SRC team, and all the enthusiastic participants who joined us today. Before we wrap up, don't forget to join us for our next session. It's a workshop on the 3rd of August. The title is Crafting a Research Idea from Topic to Question by Muhammad Awais at 9 p.m. Make sure you're there.